Doppler ultrasound in pediatrics. As we have studied in previous lectures, that there is a very beneficial role of color Doppler in ultrasound, especially in adults. Similarly, we can see that there is a lot of role of color Doppler in pediatric ultrasound. So vascular ultrasound imaging in the pediatric age, we will be discussing it. What is the methodology and typical clinical questions? We will overview the indications. We can have different modalities which are used for vascular imaging, which includes the ultrasound, CT angio, MR angio, and angiography. In vascular ultrasound, the basic method is to have 2D imaging. We use color Doppler imaging, duplex Doppler imaging, which is the power Doppler ultrasound. The duplex, the word duplex means two. So whenever we use 2D with color Doppler, we can call it as duplex. But sometimes people call it duplex when we use color Doppler along with power or spectral Doppler. The other options are B flow imaging, which is used with ultrasound contrast agents and contrast harmonic imaging. We can have MPR, 3D, 4D ultrasound imaging, and endoscopic ultrasound. Color Doppler ultrasound in pediatrics, the first point is that it can be used as primary imaging method. It can be used as complementary method and for clinical research. Secondly, it can be used for diagnosis, for guided therapies, monitoring, ultrasound guided monitoring or therapies, and follow-ups. Methodology. The types and size of transducer is important. We use linear array transducer with higher frequencies in pediatric group for peripheral scanning or vascular scanning. But for abdominal scanning with color Doppler, we prefer to have higher frequency convex, which is curvilinear transducer. For instance, if we have a transducer having 3.5 and 5 megahertz in convex transducer, we will prefer to use the higher frequency, which is 5 megahertz in that specific convex transducer. Pre-settings are important as the depth of the body is lesser, so we need to adjust it. Then is the automatic adjustment, which can be performed by selecting the presets, which are already given in some high-tech machines for pediatrics. We can give sedation to the child if the child is crying or is panic. Digital documentation is important, which must be used to have proper documentation or recording. The first thing is that when we adjust the color Doppler machine, we have to see if there is any flow. So we check it by putting on the Doppler and moving the transducer, putting on color Doppler. We will find if we get anything in the color box, any flow, any colors in the color box.